subject is dear to my heart and a very important one for our community as we face budget cuts and work together to provide the best services for everyone. So I'm really looking forward to hearing what the panelists have said and welcome you on behalf of the Arizona Parent Family Coalition and NAMI Yavapai.
All right, thank you, Kathy.
And I'm no longer the president of NAMI Yavapai. Nicole Reisman has taken the reins. The brave young lady.
Thank you.
And also one of our panel members. So let me introduce our panelists. We've got quite a few. Usually I'll have a bio and a picture, but there were so many folks that I just side passed that. And I'm going to introduce all of you. If you'd like to add something about yourself, please feel free to do so. In for Dan Haley today, we have Becca King. Becca is the COO with Hope Incorporated. We have Deb Kurkowski. She is the CEO with Hope Lives, Viva La Esperanza. We have Greg Billy. He is the CEO for NASCare. We have Jeff Kazmierzak. He is the CEO with My Kid. And Christina Sabetta, the ED for NAMI Valley of the Sun. Lauren Lauder, CEO with Spectrum Healthcare. Nicole Reisman, as Kathy just mentioned, now the president of NAMI Yavapai County. Stephen Sheets, president and CEO with Southwest Behavioral Health Services. Tamara Player, is Tamara here? Tamara, yeah, there you are. I knew you came in. Okay, president and CEO of Polera Health. And we have Trish Reiner with the Northern Arizona FIC Family Involvement Center. So thank you all of the panelists for being here. Our topic today is current challenges and the impact of budget cuts to behavioral health services and how NAMI affiliates can help through their in-person and virtual programs as funding is cut, as programs are cut, as some organizations are facing staffing challenges. It's really impacted the services, in particular for a lot of the youth and the SMI adults, especially those that have maybe not got the access program. So I thought it might be helpful if the panelists would kind of jump in and say what your organization is doing and what your challenges are. We did not provide a specific list of questions. I think the topic is broad enough and hot enough that you should be able to come up with some good information.
I would like to add that we also have Crystal, who is with the Mad Moms, and there's other groups that are voluntary in the community, and I think we should include them in the sense that how do we all work together instead of being so competitive? How do we work together to provide some of the services that we're going to lose? So thank you, Lori.
Okay, so Becca, would you like to open this up?
Sure. Hi, everyone. I'm Becca King. I'm with Hope Incorporated. And if you don't know about us already, we're a peer and family run organization that started in Tucson, but has expanded statewide over the last several years. We have center-based services and programs throughout Southern Arizona, from Nogales, Sierra Vista, Douglas, Tucson, in Yuma. And then we have a co-location with Spectrum Health in the north in Prescott and Cottonwood. As a peer and family run, everyone who works at Hope has lived experience in recovery. I myself identify as a peer and a family member, and I came into working at Hope because of experiences and challenges with getting my mom services. And so, you know, the trouble that we're facing, you know, going forward with relation to budgets Just as an example, I think a lot of us were affected by the ARPA cuts that happened and just how abruptly that shift happened, and having to adapt with no notice is very challenging. And the programs, some of those ARPA funded programs allowed us to enter into communities that we were not previously. So we were able to add positions doing outreach and engagement and helping get people into services. And whereas previously we may have been looking at sustainability for those types of programs, we're in a position now where we may not be able to sustain some of those programs because of the challenges associated with not just budget cuts, but also tighter restrictions with licensing at ADHS and evolving changes with access and the health plans. And we're doing the best we can to kind of evaluate and analyze what how everyone else is trying to anticipate what the changes could be, and preparing for having to look at programming if needed, and also just working smarter, not harder, and where we can afford to be more lean. But a lot is still up in the air, so it's challenging for sure.
So Becca, I don't know if you can answer this. Can you give me a number of how many individuals are served? And when you say programs were cut, which people were affected and how many then are not being served?
So with the ARPA funding specifically, we had about 7 positions that we immediately identified that were affected by those cuts. And what we did was try to move who we could into vacant positions elsewhere. So really trying to leverage the vacancies that we already had, and so that we didn't have to lose or lay off staff. And we were able to do that for a majority of the positions, thankfully. We're just looking at working with our community partners on other opportunities to engage their members, if not through that funding, transitioning folks to other services with other providers where they can be supported if we're not able to. So for the most part, we've been able to kind of keep things going and use the center-based services to try to fill in the gaps. As far as numbers of members, I don't have that information readily available. I apologize, but we just are working with our community partners to try to fill in the gaps where we can. And so Summit Hospital in the north is a great partner for us in the Show Low area. And, we partner with Hope Lives in the Mojave area and other places. So it's, just trying to leverage that where we can.
All right, thank you. Anybody have questions right out the gate for Becca? I'm sure
Yeah,
some will circle back.
Just a common thing that I would be very interested in hear from all the presenters is how you guys might reach out to other groups like NAMI or other providers to fill in some of these gaps. And is that feasible economically? Thank you.
Okay. We'll just go down the list, which was alphabetical, and that would put Deb Kurkowski in the hot seat next.
Okay, well, much like Becca, we are a peer-run, peer support agency. We're located in Phoenix, Flagstaff, and Kingman. And with the ARPA funding, we also had impacts. It was much smaller, I think, than Hope Inc. We only had half a person that we identified as directly impacted, and basically we've continued to try to do the work because it was a brand new jail inreach initiative in Phoenix, and we didn't want to stop servicing the people that we had already been reaching into and scheduling pickups from the jail. I didn't want to leave somebody sitting on the curb because the funding was taken away. So we continued to do the work without the funding, just trying to find other ways that maybe we could find funding, make it billable, I challenged my team to get creative, like how can you? Um, I know across the board because one of the biggest impacts we've seen in funding, and I think it's true of everybody, is when we lost the H 2016 bill code. I know a lot of the agencies are trying to pull numbers together to send off to Access to show them what the impacts were looking like and if it would have impacted staff. And I know I've already identified 2 staff positions that we let go because we didn't have sufficient funding. And for our members, that just means more people up to the limits, right, of the 20 per group that we are cramming into groups. So instead of maybe having as many choices of what you can do right now, you have 2 choices. So you can go in that group or that group. We're seeing significant financial impacts from that one change alone. I'm going to say it's going to be $500,000 to $1 million probably by the end of the year that we will have lost just from that one bill code alone. And I'm sure other agencies, it's even more significant because our agency is pretty small. And, so the impacts are probably not as big dollar wise. It's significant to us, but it doesn't sound as big as maybe some of the other agencies who are probably looking at double that. I know we're having problems filling positions. I think everybody has that same challenge. If the money's not there, it's hard to attract good talent when there's other places that can pay more than we can. Much like Becca said, we're trying to move people into different positions where there is funding available, but a lot of grantors are pulling back on their funding too. I had several agencies that we count on for grant money organizations who said, gee, sorry, only half as much this year because we're losing money too, or we're not getting the same level of funding as that we've have available in the past. So that impacted a lot of what we did too. As far as partnering with other agencies, I think that was your question, Kathy. I think that most of the peer-run organizations play really nice together, and we really do try to help each other. I know when I was looking for temporary space, I was calling lots of different places, and I had a lot of agencies like Trish say, well, if you can use my space, you're welcome to it. So we have tried to work with each other, and I think that's been fabulous. I'm not too sure how to pull in like NAMI and some of the other organizations. Maybe that's a conversation that we can have while we're out here together is maybe how can they help? Because I'm not really sure. So
Absolutely. And we have a few people representing NAMI, and they will be sharing that information, making it easy. There's a bridge that I think, and that's part of the reason for this topic to bring you together and to help with that accessibility. So thank you, Deborah. Next in the hot seat is Greg Billy.
All right. Hello. I'm Greg with NASCARE, and we are also a peer and family run agency. And we're in various locations, Kingman, Bullhead, Prescott, Cottonwood, Apache Junction, Casa Grande. And first of all, obviously the what everyone else said affects, same kind of issues. So since we're in the same industry, those same kind of issues. Specifically, for example, the NT19 funding, that's was cut a lot. And we've had people to say, look, we can't give services. I'm sure like everyone else, even when I talk to my staff, there's like, well, we really want to give service to these people. And it's like, yeah, but we can't just do that. It's not just a matter of wanting to, it's difficult, right? So that has been a big issue, just for one example. More and more about people losing insurance, to be honest with you. This has been more of a newer thing I'm hearing more. Just recently in this past week, for example, we have a warm line, for example, and I'm here, well, this person, that person lost insurance. Okay, then I talked to my senators. Well, some of these people have lost their insurance. What are we going to do? So I'm not the insurance change that I am hearing from everyone else is I'm hearing it, and I'm hearing it a lot recently. So just to let you know, that's obviously as far as the effect, where that goes, how many people it is, how that shifts with us ultimately, I don't know, because all of this stuff is kind of, happening, I guess, quickly or in different ways. So I'm not sure. Obviously it doesn't help. So we're just working with it as we are right now. But those are things that are affecting us. Staffing, for example, it's it's getting people to work. I would say pay, as far as paying people, I can pay people more, offer more. It doesn't mean we're getting quality or people who want to work or whatnot. So, and why does it affect it? As you guys know, it's hard to provide more services. We provide transportation. You know, more staff lets you do more services. So for on our staffing end, it's not so much even, are we willing to hire people? We need people that want to work and do that kind of thing. So that it kind of affects providing services. But I'm getting a little worried with the funding and all this stuff because that does, you want to hire, right? And you're like, well, how much is this going to affect everyone? So that then, I guess we'll see how that plays out, right? So with how many people we're able to hire and provide. And I think with referrals, as we know in our industry, referrals has always been difficult to get referrals, from various agencies. But I think it's probably even harder now. I've noticed that's even been the last, year and so forth. I think probably because of the changes in funding and insurance and all that. So that's obviously going to affect the referral process. Kathy.
So Greg, I'm hearing from people about cuts and all that, okay? And how
Yes.
they're packed. I've been hearing this for a year, okay?
Yeah.
What I'm interested in hearing is what can we do about it? How can
Okay.
we work together as a community, especially up here in northern Arizona? And, what can we do about it?
With NAMI, like you
Well, not
asked.
necessarily.
Oh, okay.
How can you partner with Spectrum, or how can we do something with the health department and have groups? I mean, what can we do to continue the outreach and services to our community?
Okay, well, for example, like just because NAMI was one of the first things brought up, is we could definitely let our staff and all that know to like get a contact person. Like here, if we have trouble or we can't serve someone, that's one thing we can do for sure, right? Outreach, direct them more, and I guess we could talk about how more that could work. But there's no reason why we can't say, hey, we're specifically have this contact, this organization that has these services, and you know what I mean, help them work with them. As far as, let's say, another organization, Spectrum or someone else, I'm not sure if we have someone, unless we can, I mean, if we don't have the funding, I'm not sure. I'm not quite sure, honestly, how we would. That's a good question, how we would work with them. Maybe some of the things that I know we don't get funding for certain things, so maybe they have funding for other things that can cover that. But I mean, we're willing to work with others.
I know that we have been talking to Complete Care and is that the right one? Or
Yeah,
Centene?
yeah, complete
Okay,
care.
so we've been talking to their CEO and some of their people and saying, well, how could you help with transportation, like in Southern Arizona? And Carrie is on the line. How can that NAMI affiliate work with the REBA to maybe provide, fill in some of the gaps? So we're just starting those discussions, and at some point we need to bring in the plans to see, how they can, chip in too.
That's a great point. You're right. How could some of that transportation be filled? Because when you're short and you can't get certain people, or some of those organizations aren't very good, that would be helpful if there was more resources to be able to help with the transportation for sure.
Thank you.
Okay. Next, we'll go to Jeff.
Yes, good morning. Jeff Kazmierczak, CEO for MyKid. MyKid has been around 38 years. It's a peer and family run organization with 8 different sites located across Arizona. I won't name them all, but they're on our website. Specifically in the north, we operate in Kingman. We have a pretty large facility there, servicing over 300 members and families, Bullhead City as well. And then we do, where we don't have brick and mortar locations in the north, we do have staff that are strategically located in areas where service needs tend to be higher. The 3 main points of impact that MyKid really tries to hit based on the mission of family support is really number 1, prevention, number 2, navigation of available resources, and 3, parent family reunification and or support for alternative disposition. So those 3 things really are the deliverables that we are focused on to not only help strengthen families, but thereby strengthen communities. As far as the coordination of resources, again, over 90% of our staff have lived experience. And again, I think, all this rhetoric and all of these very real things about Medicaid cuts, when I think about the wealth of experience we have with staff, again, that have that lived experience, they can, and with appropriate training and credentials if needed, they really are the people that can really more efficiently address some issues versus just winding up going into a clinic and maybe they're not even matched with somebody that has some lived experience, that has really had kind of gone through some of the challenges that people with behavioral health challenges and substance use challenges face. To Kathy's question, I would say that we try to do a lot of community-based resources, and again, by doing the community-based events, those are open to the public. Not only do we have MyKid families and children attend those, but we can have anyone from the community join. In the South recently, I attended one. It was a little bit south of Tucson, and we had NAMI from that area there in the southern sites, and a number of other nonprofit providers as well. So that really, again, I think we always should be looking for ways to strengthen that. But again, I think it starts with one, and then you build on that, right?
Very nice, Jeff. You're speaking to my heart now.
Yeah, and again, I mean, easier said than done, but I think it's to get out of the box, to take that risk, to get comfortable partnering with maybe people you haven't partnered with before. And I just think that starts with an introduction. We do have things on our website that I think have helped draw people in a little bit. We do a lot on Instagram postings that I think also has attracted volunteers. We have quite a number of volunteers now as part of MyKid. We didn't have that just a year ago, and now I think we have over 75. Of course, that does take some money to coordinate that and do that. Hopefully that is something, of course, that I would be somewhat fearful, hopefully that we don't have to cut that, or we're going to certainly try not to cut that. So those are some of the challenges, but I think with some of this chaos, if you will, I think there does come opportunity. I think it starts with seeing some opportunities and some optimism that maybe this will push us to do things a little differently, a little more efficiently. But again, as others have said, I'm fearful of what that may look like, at least in the beginning, where it looks like we're going to get a pretty bad reset, if you will. And lastly, I would say my kid, there's some things we do not do. So then, of course, that collaboration, we do not do substance use disorder services at all. So then, of course, we're always looking for, good partners to refer, and we do have a wealth of those, but we're always looking to cultivate those relationships.
Very nice. You're on mute. You're on mute.
Oh, there,
You're
I was having trouble with it. My dog had barked and I muted him. Okay, sorry about that. Thank you, Jeff. I think that for consistency, we'll hear from all the providers and then we'll go to Christina and Nicole so that they will have heard everything where these gaps are and help educate where they can help and how and to fill in. So that would put Lauren Lauder next.
Well, good morning. First, I want to just really say thank you to Lori and Kathy for gathering us all together. I think it's great. And I think that the more we can talk about the challenges and the more we can talk about some of the solutions, I am extraordinarily grateful for. I will also say, after following Becca, Deborah, and Jeff, I kind of want to say ditto. But I do have a little bit more to say, just to kind of talk. I know, Kathy, you were asking, you wanted some really specific answers, and I want to talk a little bit about some specific challenges we're having. And then I really like some of the stuff that everyone was saying around how to move forward. So I'm going to elaborate, and it might sound similar. I'm not going to, I do agree with Becca around the ARPA dollars, just to kind of reiterate that. But another piece is some of the grant funding that we saw end very abruptly. And I will say, from a larger scale, when those things happen, it is a pretty big system disruption. And I also recognize that we have very limited to no control over those things. However, we had multiple staff impacted and a few programs impacted by those services or by those dollars. Some of them serving adolescents. We have a unique line of business at Spectrum where we do what's called wrap care. We serve individuals who are adolescents that I will say honestly cannot get into services anywhere nationwide. We've served 3 very complex, and these have been longer term, very complex adolescents. Couldn't even get them into centers in Florida, in Utah, nowhere. And usually what we do is we bring them into a home and we do whatever staffing is appropriate. Sometimes it's 2 staff with 1 adolescent, sometimes it's 3, sometimes it's 1. And we've seen that program be very successful. Clearly also, so because it is in the community, it's in a home environment. And then the goal is to reintegrate back into their home, wherever that might be, or the community, if that's what's appropriate, depending on the person's age. That is not a program that we are able to sustain anymore due to grant cut funding. The other program that we had to cut that I do think is a gap service, and I think, Kathy, to answer your question, this is an area, in listening to everyone, I think we can do a better partnership with this program. We had a program called Second Responder. And so, we all know what first responders are. And Second Responder, that program was funded, and the intent was around individuals who were seen in crisis, yet maybe had commercial insurance, not what some of us are used to working for in the Medicaid system, not some of those insurances. Yet they were not able to engage in services due to the cost, or maybe their insurance didn't cover it, or they couldn't get into the type of service they need because it wasn't available in the area where they were, all those kind of things. So that was one of the other programs that was impacted for us with some of those grant dollars. And I think that that has been, and I'll own this, a little bit of a miss for us in that we could do a better job in reaching out to the peer run organizations and asking our families, you know, would you like to be connected? Is this a resource? So I think that's one area for that program that we can do some connection there. We have been able to successfully serve quite a few of them because we were able to get them onto some insurance plans. So that was really good. But I think there's a gap there that they could really use some additional services that we can connect. So I'll definitely do some of that with you all. The other piece is we here at Spectrum just ended our Anywhere Care specific line of business. We are still utilizing that philosophy and still doing very community-based services. However, we had a separate line of business that was Anywhere Care, and we would go and provide medical and behavioral health services in someone's home with designated staff, designated medical assistants, and the transportation costs for that are very high and the reimbursement doesn't match. And so we made the really difficult decision. This was honestly about 2 weeks ago. It's pretty new. And we ended that program. Again, that was another one that we had multiple grants that sustained that for quite a few years. And it's also a program that we really saw some pretty significant impacts in meeting the health needs of individuals. So we were able to really provide some pretty significant primary care services, wound care, all kinds of things like that. And so I'll be honest, I'm not sure how to fill that gap outside of kind of a home health care, but the reason why that started was because there wasn't that line of business. I think the other thing, and I think I would be remiss if I didn't say this, advocacy. I also think that you all are the kings and queens of advocacy, and we need that now more than ever. And that's not just here's the other thing. I think for me, it's not just, you know, talking to lobbyists, talking to legislators. I think that when we talk about advocacy, that's what people often think, like, I need to call my senator, I need to call my representative. I will say one of the things that I have learned over the last 2 years is it is also equally as important to talk to your neighbor, your barista, who, if you're going to get coffee somewhere, or even if it's at a little cafe, to talk to all of those individuals. Tamara and Stephen have definitely heard this, but one of the things that was alarming and has been alarming to me when we talk about Medicaid is individuals do not understand that their health insurance is Medicaid. They think, well, you know, I have Arizona Complete Health, that's not Medicaid. I have United, that's not Medicaid. I have Mercy Care, that's not Medicaid. It is Medicaid. And so that is, you know, really educating everyone and talking about our system and our system challenges. I do also want to talk a little bit about, and I can't remember exactly, maybe it was Jeff who touched on it, or I think Becca definitely. We are definitely feeling the squeeze in non-Title 19. So individuals who are not on access. We saw that first, I will say, at Spectrum with children and adolescents, and those funds being very limited. And we're experiencing that statewide. So we are a statewide organization, and we're seeing those services be limited solely based on funding. So what we have chosen to do is prioritize medical services and counseling, if those are the services that someone is receiving. So that means psychiatry, primary care, and counseling services. We're seeing that in different regions throughout the state for individuals with an SMI diagnosis as well that are not on access. But the funding is becoming very limited. I think the other piece, I will say again, as Spectrum and as a provider, historically, our answer has been yes to everything. Yes, we will do it. Yes, we will show up. Yes, we will be there. Yes, we will partner and provide the services. And the really uncomfortable thing that we are experiencing now is having to say no. I will tell you that we don't like it. Our staff are really struggling with it. We're unfortunately in a position where we simply can't provide uncompensated care. And that's the challenge. I can kind of reiterate a little bit too. You know, we have space. We're happy to share space. As I said, you know, with that second responder, I think we can do a better job in doing some partnerships there. I love what Jeff said of, you know, becoming more efficient. One of the challenges I think that we face, it's a blessing and a challenge, is the use of technology. And technology is expensive. We embrace technology. We need technology. We have to use it. However, we have to also recognize that it is expensive. And so any ways that we can utilize that to serve individuals and for that to be efficient, I think we're always looking for those ways. Like, stop typing now. Why?
Yeah, thank you. Thank you, Lauren. Sorry to hear about the Anywhere Care program ending. And you've got that big van that you were taking out.
We're still taking, so we are still taking out the van. We're still going to places like the shelter. We're still going to other communities. However, we're not doing kind of one-off with just one patient. And we had multiple staff associated with that program. And we did move those staff into other positions within our organization.
Nice that you were able to do that. All right. Next, Stephen.
Sorry, I had to jump off my camera, so I apologize for not being on camera right now. I mean, I not to add to what already has been said, but I would say that we just like other organizations have been feeling the struggle with keeping up with providing care that Lauren had said just very, very beautifully, that providing care that really has no compensation model, which I think we've been doing for a lot longer than what we're experiencing right now. I think there's a lot of different elements that are creating a tighter squeeze on resources now compared to other years where we may have been able to pull from different funding buckets to pay for the services that were being provided. And so I think a very common thing that we've kind of heard is, at Southwest Behavioral and Health Services, we serve the northern region, the central region, and we have very small exposure in the southern region in some school-based settings. And more recently, we've had to take a look at the funding categories where we're predominantly capitated, where we get paid a block amount every single month, and really right size to that that block payment. And so in the central region, more recently we've downsized our jail transition program, which really was helping individuals transition out of the jail system in central Arizona who may have experienced more petty offenses, more misdemeanor offenses, and trying to line up outpatient treatment and then housing opportunities for the seriously mentally ill population and the general mental health population on adults. And we've also needed to right size some of our in-home counseling programming for specifically for the SMI population in the central region. I think I heard earlier from Becca, and if this is wrong, just you can tell me I was wrong, but we've had to do some right sizing of our administration too. trying to provide more service or more quality driven service with less resources, which is not an easy thing to do. I think one of the things we could do better is we very similar in fashion as Spectrum. We've been when somebody asks us to do something, we say yes, which really has in turn caused us to do a little bit of everything and not necessarily be the expert in every area of every area of service delivery. Um, but we don't need to be the expert in every area. We have great partners that might have additional funding in categories that we may have limited
Yes.
amount of funding. So I think one of the things we could do as a group or as a collective whole is say, what do we have as resource allocation, and how can we elevate and champion the areas where people are experts and really shift service delivery to those areas, so there's no risk of losing funding for individuals that might not be billing up to a block amount, and there's no risk of being over in those categories as well. So I think if we can figure out a way to be transparent within our system on a funding lens, we may be able to serve more individuals or the same amount of individuals with really leveraging our resources, because we have a really fantastic system of providers that do a lot of great work, and I think we could do a little bit better at leveraging resources where funding may be available. So hopefully
I
that
love
that's
it. I
helpful.
love it. This is a real concrete idea. I love this, Stephen. Exactly what we were looking for. Go ahead. Sorry, I just wanted to share my enthusiasm.
No, thank you. I think that's a bit. I do see somebody introduced me. Sorry, I did forget to say I am the CEO of Southwest Behavioral Health Services. So thank you so much for hosting this, and I hope we can just continue to elevate each other in practical ways.
Absolutely. And I think when it comes to funding and dollars and cents, it is important for the organizations to do some tracking and be able to demonstrate how much money is saved because of services, how services do reduce recidivism, inpatient, jail. And it goes without saying that when you're reducing those things, you're improving the quality of the life of the individuals being served, which is why we're all here. So moving on now to Tamara.
Well, good morning, everybody. Tamara Player, the President and CEO for Polera Health. We provide integrated behavioral health services throughout Yavapai County. So lots of the challenge with rural areas, that you've already heard from Lauren and everybody on this call. I would say ditto to what everybody has said in terms of the challenges that we have been facing. And this is before the big federal cuts, right? I mean, certainly we can talk about some grant dollars, and we've been impacted by grant dollars and the SABG funds. I mean, all of the challenges with funding. I would also just say our system's been through some pretty significant disruption, right? And I think it's important to acknowledge the impact that the fraud, waste, and abuse had on our system of care, on how ADHS then responds to providers, how Access responds to providers, and the expectations that they've had and shifts that they've had to make because a direct result of the fraud, waste, and abuse. So all of this has been happening even before we, some of the stuff at the federal level began happening. I think in like March, we started to see some of those federal dollars go away. So it's been a system under pressure for a couple of years. And so one of the things that we have done is to really look at our resources and where do we need to put our resources. So like Stephen reflected, and I'm sure others, like we right-sized administration. We're constantly evaluating those positions. And it also means at times saying to our partners, health plans in particular, like, why are you asking me for this report, right? Like, because if it is not contractually obligated, we're saying no, not because we don't want to be a good partner, but I have to use my resources in a very specific manner. We have a partner advisory council. We're celebrating our 5th year, actually, in July. And they are individuals who receive our services. And so over the last, I would say, 6 months, the conversation has been, so here's our reality. What do you value? What do you not value? So if we have to stop something, what are those things that you're like, just stop that, Tamara, but keep these core things? We have implemented a new models of care team that really focuses on matching the services based on the individual's needs. So we're providing the right service at the right time for the right amount of time. Um, so that's helping to celebrate people's success in treatment and helping them move on, but also ensuring that we're wrapping around the individuals that we need to wrap around. And we're looking at all kinds of partnerships to help leverage that. So on the children's side, we work with FIC for our birth to 5 program specifically, because we do not provide any family support from that perspective. Our therapists do family therapy and things like that, but that's not the same as what FIC does. At our CSU, we have a partnership with Hope that I think Becca just reflected some of the challenges that has been in place to really move that forward. But the goal there is that anybody coming into our CSU is connected right there with peer services, so that it's a warm handoff right in the moment, right? It's not, how do we connect them afterwards, because we know that oftentimes that doesn't happen. And so how do we further leverage those partnerships to support those really critical transitions of care that happen? And then this is more of a, again, systemic thing. I will just say, through the Arizona Council and the advocacy that happens there, much like the advocacy that happens with many people on this call, we were able to engage with Access to really talk about provider sustainability and where are there things that we need to be stopping, right, as a system. Like, we just shouldn't be doing it anymore, so that we can really focus in the areas that we know we want and need to improve, and that we're using our time, talent, and treasure in ways that are really helping to take care of people. It's wonderful to have people from Access at the table and listening to that. And I will also say, it's hard to get to know. And I think as a system of care, we not only need to look at the partnerships that we need to leverage and how do we do that, but how do we get to say, no, you don't have to send in this report anymore, because it really doesn't bring value to the system. Or maybe some one person thinks it brings value, but it's not bending the needle in the way that we need to. Because as a system, there's lots of opportunity that we have, and I think Jeff reflected on this, to streamline, to become more efficient and effective. I cannot tell you how many spreadsheets we have to fill out and send in. And I just want to say, really, another spreadsheet? Or do you want me to take that resource and serve these 5 people? Because I want to serve these 5 people. So it's leveraging partnerships, and providers are doing it all the time. We talk about, can we share this resource? I had a need not too long ago for credentialing, and I reached out to Stephen and Lauren to say, hey, do you guys have anybody who can help me? So even in ways that aren't transparent in terms of service delivery, but as we look at how do we become more efficient and effective so that we can focus our time, talent, and treasure on serving our community. At our board level, we are preparing for federal cuts and, saying, okay, here's kind of tier 1, tier 2, tier 3. When we get to tier 3, it's draconian, right? It is cutting lines of service and impacting access to care in our community. So just Friday, when I was meeting with our executive committee of the board, I'm like, what are those partnerships that we can leverage? So if we can't do it, is there a way that we could do it in partnership with somebody else? Or do we talk to somebody who maybe can come in and do this service line if we can't do it, right? So those are the conversations that we're having. Very strategic at this point in time. So I'm not in a position to talk
So
about that.
Tamara,
Yeah.
sorry, so you're just talking about what Jeff, Stephen had kind of referred to is, finding some partnerships. So you're doing this with your management. Okay, so have you reached out and started these conversations with others?
Yes.
Okay, and it's
Yeah.
secretive at this point.
Well, it's just, it's,
I'm
no,
teasing.
it's not about secretive. It's just, it's very strategic and,
Okay,
things
so
are,
are you working with Jeff and Stephen and some of the others at about some of this? How to streamline and,
yes.
oh, very exciting. This is very, very exciting.
Yeah.
Okay,
And we're also looking at partnerships outside of this area, right? And like, how do we leverage those partnerships, that technology, whatever it might be, to again um, reduce, if you will. Well, I mean, it's not reducing. It is streamlining processes, as Jeff said, right? To ensure that we can focus our dollars to provide care. So 65 cents of every dollar that we bring into the organization goes to pay for staff and benefits, right? Staff salary and benefits. That doesn't leave a lot of room for anything else. Uh, and so, we are fortunate, knock on wood, we haven't had to do layoffs yet. We've definitely done hiring freezes on the administrative side, and we critically look at every open clinical position that we have before we fill it. I think Greg referenced it. Sometimes it's hard to get the talent that we need for specific positions. Um, and then the work that we do is really hard. So when you're doing hard and purposeful and meaningful work, but you have all of these, I'll say, little dog bites at your heels, which is happening for our staff right now because of the fraud, waste, and abuse. People are choosing to leave the field, right? And so we're seeing that certainly in our area, and then it makes it challenging to recruit that top talent that you really need, who have the skill sets to provide those services. So I feel like I rambled on, so let me pause and see if there are any questions or things you'd like further clarification on.
Tamara, I think one of the things you and I had talked about recently was that what you described, this like wear down, right? I mean, it's hard enough to do the job, the work with the challenges, the increasing challenges, and even some of the, not only just behavioral health substance use, but concurrent medical conditions that we're seeing coming out of the pandemic. And it just seems there's more and more of that. But then the wear down for, send this report off, or we need this report done, and I think that has made it, that's made it tough.
It has made it tough for sure. Again, on the staff specifically, I was sharing with Jeff, I had some staff come and just say, can you just get them off my back, right? Like, I just want to do this good work. I'm doing good work. I know I'm doing good work, but I'm constantly made to feel that I'm not. And those are the things, right? It just makes it really, really challenging for us in our system of care.
and that's
But
what I'm hoping, that as a community, advocates can help change some of that. And we've been talking about that. It's difficult.
yeah,
Thank
but
you.
it's that partnership though, Kathy, that you just mentioned, right? That even on the advocacy side, we need to do that. My question to Access recently was, would you ask primary care to submit all of this stuff to you? And they wouldn't. And they don't because the model doesn't support it, right? The fee-for-service model. But while our system has shifted to 100% fee-for-service, we still require the same thing, like where, this other system reimbursed in a different way, and we can't work that way, and we need to really hold our systems accountable to why do we need this and how are we going to use it and how is it going to help us achieve our goals in providing the best quality care in Arizona. And if it doesn't, and we can't answer those questions, then we need to stop doing it. That's hard. Saying no is hard.
Absolutely. Yeah, working smarter, not harder, being efficient, and continually having to do more with less is very difficult. So let's hear from Tricia Reiner with Family Involvement Center.
Hello. As she said, I'm Tricia Reiner. I'm with Family Involvement Center. We have offices specifically in Tucson, Phoenix, Flagstaff, and Prescott Valley, but we are statewide. We're a family-run organization, and we primarily focus on the youth side of things. So we enrolled mostly children in our services to support parents in helping them navigate a variety of challenges or systems that their kids may be involved with. We also do skills training with youth and some counseling. So one of the biggest things, without going through I agree with everything everybody has said. We at Family Involvement Center, we are small. And so every dollar we don't get for services or claims denied impacts us greatly. And so we really have been having to look at a lot of our grants that we have that we don't know if they'll be stopped tomorrow. Really looking at how do we have those great staff that we have working specifically on grant funded projects, maybe moving them, teaching them how to do billable services under Medicaid, but then with Medicaid cuts, it's just a constant work in progress. And being that small agency, having to be thinking and creative and thinking of all that stuff means pulling people off a line to not do those valuable services that we provide. One of the things that I'm hoping comes from all of this is I remember back in the day when the child and family team was first rolled out, and there was a lot of marketing and a lot of support with access on changing people's views and how they viewed parents and how parents were considered the experts in their child's care. That stuff has kind of dwindled. We've seen that over the past several years. But back then, we all were very creative. All of our system partners, our behavioral health homes, our boys and girls clubs, anybody that was in the community schools that we worked with to support kids and families came together, came to community meetings, and maybe FIC would take this piece, the school would take this piece, Boys and Girls Club could take this piece. And so all of us weren't trying to figure out how could we just bill for this service. And if we can't, then the family doesn't get those services. So I'm hoping we can kind of get back to being that creative piece and supporting folks. With FIC, we thrive on partnerships. So like Tamara said, we partner with Polera. We have monthly meetings with them to talk about families that we're working with, as well as maybe what Polera is doing, what we're doing. And so that we're not, we're all on that same page, and how we can each kind of share what that family needs and take a piece of that to better wrap those families so that they could be successful. We meet with Spectrum once a month as well to do those same type of things, making sure families have everything that they need. So we do have a lot of variety of different programs that we do those things with, but I think we can do better with that. I think if we could partner with all the behavioral health homes, all the community agencies that our kids are connected to, the better families are going to be served in our communities. Right now, our biggest challenge, specifically right now, is prior authorizations on the skills code, which has dramatically affected our summer program. So we went from a 6-hour program to a 2-hour program without having to get all those prior authorizations. Families have had to find other solutions for their kids. Summertime is kind of a big thing that we have with our programs as far as getting kids to be able to regulate their emotions so that by end of summer, they go back to school and they're able to sit in school all day without parents having to leave work, go pick up their kids. We have a shortage of providers, so there's nobody else there. Parents have to do that usually on their own. More kids then going out of care or out of home, which is a huge cost when you know, we might be able to just do some living skills with them. That would be a much better and more effective ways to keep kids in their community. So, with all that and everybody else that they've said, I'm really hoping that this is a way that we can really all come together and get creative like we did many years ago out of necessity, and be able to support parents better.
Thank you,
Over.
Trish. And yeah, we do need the collaboration. It's good to see that so many of the providers are collaborating with each
Mhm.
other. But we know that we need to see the services that are not going to be provided, the programs that are going away. We need to see those gaps filled, and that's why we have NAMI here. We've got a comment from Tamara, and then we'll go to Christina, and I want to spend then the rest of the time on NAMI. Go ahead, Tamara.
Well, just really quick, so Trish said something about CFTs, and it just reminded me of an experience that we've been having, and I don't know how aware everybody is about this, but the health plans have what they call METs or STEM, and I think an unintended consequence of that. So it's essentially the health plan get a family or an individual's treatment flags, right? So maybe they're using a lot of services, and so it causes some audit trigger for a health plan. Um, the health plans will have what's called a STEM or do a MET, which is a review, but they do it outside of the CFT or the ART. And so we will have a whole treatment team. So to your point, Trish, right? Like we'll have the family there, we'll be engaging. The parent is the one driving this. And then this alternative review happens outside of an ART or CFT. And it can totally negate everything that was decided on with the family or the individual. And so I'm just, again, probably for a conversation for some other time, but I'm not sure how visible that is to everybody and
That's
how
an
that.
issue for C3. Let's take it up, escalate
Okay.
it. I
Okay.
mean, if we could just do that, that's big.
I think the other piece with that too, to piggyback on what Tamara's saying, one, it's a time issue for us in the staff allocation of time, and the staff then feel it kind of ties into what Tamara's saying about providing good quality care. They then feel fearful because clearly the health plan is in a position of power. They're talking to a clinician or case manager. And so they do feel like despite having this adult team meeting or child and family team meeting, they are going to be overridden. The other really, key factor is this is a service that is contracted out through Centene. And so when our staff are meeting with these individuals, they are not familiar with the Arizona system. So they are making recommendations that may not be necessarily appropriate for the region, for the person, things like that, that staff are like.
Making the recommendation.
Yeah, that's, yeah, let's
It's
take
the
that up.
individual that's part of the METS program.
Okay, okay.
Yeah,
Thank
with
you.
Centene.
Definitely,
We'll do
we'll
this.
bring that up with
C3.
C3. So now I'd like to move ahead. Thank you for being patient, Christina Sabetta, the ED with NAMI Valley of the Sun. Shed some light on how these organizations can work with NAMI and what NAMI's doing.
Yeah, well, first, thanks, Lori, and thanks, team. Glad to see all of you here today. First, I just want to say I'm sorry. This is not a fun time to be working and running a provider organization. It's tough, and the reality of it is it's not going to get any better. This is just the beginning, and that's just the reality of it. One thing I do want to add, and I know others have mentioned this throughout, but advocacy is huge right now. You know, we see the $1 trillion spending that our federal government wants to say. We've seen the House pass the big, beautiful bill. Now it's at the Senate, and the Senate is still that we've had some pushback, and I think some of our advocacy has worked. And now they're having to go back and find how they can maybe save some Medicaid funding. But they're still hoping to get something done by July 4th. So now's a really, really important time to speak with our federal legislators and share with them the impact that these cuts have already had on you as a provider, and of course, as the patients, as our clients as well. So just know there's still a little bit of room to help shape some of what this is going to look like. As we know, it's all going to come back down to then how the state is going to help meet some of those cuts, but we know that's going to be very difficult as well. So please do, I'll put a link in the chat here, but there's still some time. With the additional cuts, we're going to see additional program closures, cutting of hours. We've seen some programs go down already. We're going to see increased emergency room visits, increased crisis, higher rates of hospitalization, higher rates of incarceration, higher rates of homelessness. I mean, it's all only going to get uglier. Loss of prevention services, strain on families and caregivers. We know with NAMI, we see parents every day who are struggling to meet ends meet and are just praying that their son or daughter's benefits aren't going to get cut. And that's there's likely to see some cuts there. We're seeing mental health outcomes. We see our individuals are being deported. We're seeing a lot of anti-LGBTQ plus legislation, and that's going to continue. That population has just been cut out from our 988 number. So lots of, that's sort of the bad news. It's only going to get worse from here. But advocacy is important. So the more we speak up, the more we contact our legislators, the more we share stories that we're seeing within our provider organizations, the more impactful people are listening. And as we've seen in the last couple of days here, it only takes one or two people to stand up, one or two Republicans at this point to say, hey, enough's enough. Like, we need to figure out how we're not going to destroy Medicaid entirely. So do partner with advocacy organizations and share those stories. Bring in folks like the Arizona Peer and Family Coalition who can train your individuals and family members on how to share their story and reach out to legislators. From a NAMI perspective, and what maybe NAMI can do, I love that we can be helpful in many of these ways, but we can only do so much. But what we can do, we do provide free support groups, as all of you know. So, or hopefully most of you know. So for any individuals dealing with mental health issues, as well as support group for family members. So any family members who have loved ones, siblings, spouses, kids with mental health conditions, they are able to attend our support groups. We work with all of our affiliates throughout the state of Arizona. So if your affiliate close by isn't providing a support group at that day or that week, you can call us and we will find you another affiliate who's offering that program. At Valley of the Sun, we go far as to connect you with affiliates throughout the country who we know may be having a free support group at that moment. So one thing to remember is that NAMI doesn't provide that treatment. We don't provide that therapy. We're not going to subscribe medications. What we're going to do is we're going to jump into that dark hole with you, and we are going to work alongside you until you can get connected, until you can figure out how to manage some of this stuff on your own. And of course, we'll still be doing advocacy in hopes that we can save some of these benefits that have been vital to and a safety net to many of our community members. But that's what NAMI does, is we provide that support, we provide that education, and we're here to do that. So whether it's free support groups for your individuals, family members, it doesn't cost us anything. We all know many of the providers here have been sponsors of NAMI programs. Thank you for that. That's what allows us to fund these free support groups within the community. Educational programs. We mentioned family members. We have an 8-week family to family class, helping them everything from helping them understand how to petition their loved one if they need to, understanding the behavioral health system, understanding how to empower really versus enable, how to talk to someone with a mental health condition. It's an amazing program. It's our flagship program, really, really helpful and beneficial for family members. Also helps family members figure out how they can get more involved in advocacy and help change the system. Something similar with our peer-to-peer. So individuals who are struggling, bring them to us. We'll sign them up in a peer-to-peer class. They'll better understand their recovery, understand different treatment options, different treatment modalities, and really connect with a community of other individuals who are struggling. I'll also add that our support groups and educational programs, we have both virtual and in person. So right now, we have about 60% are virtual because that's what we're hearing from our community. That works easier for some folks who are in treatment all day or who are working all day, who are parents and have to take care of their son or daughter at home, but still needs that support from other family members. So something to think about, within those rural communities, we have NAMI affiliates throughout the state. They can help with both in-person and virtual, again, whether it's support groups or educational programs. We also do a lot of training for staff. So whether it's our Inner Own Voice program, where we bring in 2 individuals with lived experience who share their story of recovery, who share their story of being homeless, living with a serious mental illness. They come in and share their story. It's been eye-opening. We've been partnering with a lot of providers, a lot of inpatient hospitals to educate their staff on what mental illness looks like, what recovery looks like. And that's been, for many, it's been a game changer. First responders, right? We know that as we see more and more cuts, we're going to have to rely on our first responders a lot more. So we need to make sure that they're educated and understanding of what mental illness looks like and how to be a little bit more compassionate with these individuals. We can provide that. We also have Ending the Silence, which our state has really been taking the lead on. We're doing an incredible job working with our middle schools and high schools, not only middle schools and high schools, but then we have a training for for the parents as well as the educators. Again, completely free. We need to get to these young people and talk to them. They're scared to death, especially with everything that's happening within the political environment. So with all that, I know we're almost out of time here. I could probably go on for hours. But I think, my biggest takeaway today would be things are only going to get worse. But we need to have a voice, and the more we can help and shape our voice and speak up now, the better it's going to be. And 3, we need to figure out how to collaborate and utilize and share resources, and really bring our supports around these individuals. And again, while NAMI can't provide that treatment, we are here to provide that support, and education and connection to resources in addition to the advocacy.
So
So,
Christina, this is
yes.
absolutely beautiful. I would like to just share that the Mad Moms, and I'd like Crystal to put her contact information, that they do some similar programs that's a little bit different than what NAMI offers, and to kind of a different population. But we need to partner and make referrals back and forth. So that's beautiful. All the things that you have to offer, and you're kind of a hub as the NAMI Valley of the Sun can refer out. So thank you, Christina. Thank you very much.
Yeah, you're very welcome.
And thank you also for mentioning the civic leadership development class that the Arizona Peer and Family Coalition provides. Hope Inc. has provided that, and so has, see who else do we have on? NASCARE has, and so has Polera. Erin Soto is our lead on that, and she did put in the chat how to connect to that. And this is where if you're a provider and you have a group, you can bill for the group attending these classes, and we can do them virtually. I'd like to move now to Nicole, president of NAMI Yavapai, Nicole Reisman.
I've been on mute so long and didn't know how to go off. Well, thank you. Well, thank you to Christina for going over everything, because I learn from you all the time. So I appreciate that. NAMI Yavapai, I just got into, we're just starting back out. So like right now, currently we're offering family support groups and peer support groups. Well, it's called Connections. We were only on Zoom before, but I met with Tamara and Trish, and they've been actually really nice to let us use some of their space. We're going to start that in July. We also have Ending the Silence up here, which I'm going to be talking to Vicki soon to hopefully get more involved in that, get that out into the schools. What I plan on doing in Yavapai, because, I live here, I have family here, I'm going to have one of our positions, community outreach advisor. Her name is Sarah. She's going to reach out to Southwest, Spectrum, Polera, and just kind of learn more, Fic, about your program. So when people are calling NAMI Yavapai, we can speak, at the best we can about you, help get people connected to you guys. We're in a good position right now with Angela doing the program and education advisor. if you see there is like specific cuts to like a certain population, and you see NAMI Yavapai can do a certain support group or education, this is the time we're building our program right now. Let's see. I think that's really about it, Lori, because yeah, I think we're just kind of starting out. We're excited to just help wherever we can.
What I
Okay.
find exciting, Nicole, is that you're contacting Spectrum, Polaris, Southwest, and finding how we might help out, you know, and doing the support groups on their facilities. This is nice and very needed.
And there are NAMI affiliates throughout the state. You know, this is where I'd like to see the collaboration, get the NAMI flyers in the health homes, in the reception rooms where people can pick that up for information, educate your staff about NAMI and what NAMI can provide. This is where a gap can be filled and lives literally can be saved if they are getting the support. So it's imperative. Christina?
Oh, can I just say one more thing about that, Lori, that I think is important for folks to know about NAMI? Sorry. Is all of our programs are led by peers. So if it's a connections group or peer-to-peer for individuals living with mental health conditions, it's led by 2 individuals. I see one of our volunteers on the line as well as our family support groups. So family support groups and family to family are going to be led by family members. They're always 2 individuals and they're always volunteers. With that, I want to say that, you know, I think what we've seen a lot is, and what's crucial in someone's recovery is that really that connection, that community, and that purpose. And so any affiliate throughout NAMI is always looking for volunteers who want to come in, share their story, become trained as facilitators, and help us run our family or our peer program. So something to keep in mind with patients and family members within your facilities. Thanks, Lori.
Absolutely. And I do see we have James Tobin on the line. James is with the Yavapai County Health Department and works with programs dealing with substance use and mental health. James, would you like to add anything about collaboration on the county level?
Hi, Lori. Thank you. Only just to say that having worked in the public sector for decades, we go through these cycles sometimes where budgets get slashed and contract. And so it's really important that we collaborate and network as much as more than ever to share resources, share intelligence. And that's the only way it can happen. And the good news is we do that really well in Yavapai County. We already do that really well. So we're going to have to do it even more and better now, I think.
So James, could you kind of share how we do collaborate here? I mean, give an example of that, like with the health department.
Yeah, sure. I mean, at the health department, we can kind of be a hub or an aggregator for all the other resources. And so we work really hard to be involved in groups like NAMI and MatForce and work on the line with the other treatment providers, Polera and Spectrum, and just keep those relationships strong and healthy and work towards collaborating. So I think the health department is well positioned to kind of be a what do you call that in a wheel? I know there's spokes. What's the thing in the middle? The hub. We can be the hub. Yeah. So I think we do a good job of that, and it's a little depressing, honestly, to hear, see these developments and these storm clouds that appear to be on the horizon. But it's not a time for us to be weak of heart. People are counting on us, so we have to be strong and push forward and work together.
Absolutely. Thank you. And well said, James. Any closing comments or questions before we have Kathy thank all the speakers? Anybody?
So I'm officially thanking all the speakers. You guys were great. It's obvious that the collaboration has already started, and this brings a lot of relief to me. Let's continue it. I've taken a lot of notes and kind of seen some of the highlights and things that we can capitalize on as we move forward. We have C3 coming up in this area and a couple of dinners at Spectrum, and where we can further discuss some of these issues. So thank you, everyone.